Thanks so much for joining us. My name is Neely, and I'm the Director of Education and Community Outreach here at the Center for Innovative GYN Care. And joining me today is CIGC's co-founder and advanced surgical specialist, Dr. Natalia Danilians. Hi, Dr. D.
Hello.
And we also have our special guest here, a former fibroid and endometriosis patient of CIGC, all the way from the United Kingdom, Ms. Rupal Raga. Hi, Rupal.
Hi, thanks for having me.
Thanks for joining us today. Now, Rupal, I understand you had quite a journey with both fibroids and endometriosis, and today we really want to hear about that journey, your experience, and your thought process through the entire thing. So in the beginning, could you tell us what type of symptoms you experienced, what you were struggling with, and how you addressed those?
Okay, yeah, so I think initially the main symptoms were just, it was really bad period pain to the point where I was taking painkillers, but it wasn't helping. On top of that, my periods were getting heavier and heavier as well as time was going on. And I did go to the doctor many times over many years. I have been going and saying, I keep getting this pain. I'm taking the painkillers. It's not working. And, I would get probably the same thing that a lot of women have heard. Oh, it's normal. Just have to deal with it. It's normal. And then eventually I started researching about endometriosis and fibroids, and just from what I read, I was quite sure that I had endometriosis and fibroids, and even when I did ask my doctor, they were saying no, you don't have it. And it wasn't until I really had to push to get referred and get it checked, and that is when I was eventually diagnosed with endometriosis, and my scans did show that I had a fibroid, which had gotten really big as well.
So your doctors, like when you would go to your, if you could just give us because you live in the UK, so it's a bit different than the US. And I remember you were explaining to me how over there you can't just go see a GYN, you have to see a general practitioner first, correct?
Correct. So everyone's got their GP that they go to for whatever their ailment is. From there, you then get referred to a specialist. So I was always going to my GP, and it's the GP that then has to refer you. So it just took many years, probably after 7 or 8 years, I was finally referred to a specialist who when I did speak to him and he did hear about my symptoms, he knew straight away. He did say straight away that, it does sound like this, so let's go and get the ball rolling on the tests and stuff.
But that was after 7 years.
Yeah, probably about 7, 8 years, maybe even longer. I've been complaining about this to my doctor for over 10 years.
Wow. So, Dr. D, could you kind of give us an overview of the difference between fibroids and endometriosis in terms of the conditions, and do they often coexist?
Sure. Well, first I want to thank you, Rupal, for being here today and for sharing your story. I think it's definitely very brave, to go on camera and let everyone see you, and really, but I think it's very, very important because a lot of women feel like they're alone, and maybe no one else experiences the same thing that they experience, and just hearing a similar story gives them strength to be their own advocate and seek treatment. So I really want to thank you. But fibroids and endometriosis, both a very common condition, and a lot of times we see both coexist at the same time. And some of the symptoms overlap, so you can certainly have pain with just fibroids or with just endometriosis. You can have abnormal bleeding with both conditions. So, and again, a lot of these are very common, so naturally they're going to occur together. Very commonly. The big difference between endometriosis and fibroids is that fibroids are typically diagnosed with imaging and endometriosis is missed. So a lot of patients, we think they just have fibroids, and when we go in for laparoscopy, we find endometriosis in addition to fibroids.
So would you say that the symptoms are often dismissed by medical professionals? So if I was a patient that came in for fibroids, it wouldn't be obvious that I have endometriosis unless you actually go in laparoscopically to determine that.
Right, absolutely. And you know, some practitioners, as in Rupal's case, they don't even offer to do an ultrasound to rule out fibroids, right?
Mm-hmm.
So you have somebody who's complaining of pain, complaining of other symptoms, but pelvic exams alone are a lot of times very inaccurate, unless the fibroids are very large, right? So if you have medium-sized fibroids, they can be missed. Also, not every patient is going to be, 90 pounds. So typically heavier patients can have very, very large fibroids and still they're missed because on exam, you can't feel them. So pelvic exams are very inaccurate. And it's been shown in many studies that really you can't, just because a pelvic exam is normal, you can't dismiss symptoms. You have to then go on to get an ultrasound, right, to rule out fibroids. But then at that point, you still haven't ruled out endometriosis, and that's when the laparoscopy comes in.
Sure. So, Rupal, when you went to see the physician in the UK and they said you most likely have endometriosis, what treatment options were offered to you?
So I was told that the only definitive way to diagnose it is through a lab. So when they did initially do that, then they confirmed it. But in terms of treatment options, because I had the fibroid as well, what had happened was when they did the initial lab to see if the endometriosis was there, they didn't actually treat it at the same time, even though I was told they would. I was told, right, your fibroid is very big, so you need to come back and we'll just do it all in one go. But in terms of the actual treatment for the endo, I was told that surgery is your only option.
And what type of surgery?
So for my fibroid, they told me that it's open surgery. So it's like a big cut. It's a 5-night stay in hospital, and you've got like about 6 to 8 weeks for recovery. And I had already researched beforehand. I thought, when you have these conditions, you want to research it. So I already knew that it was possible to have a lap surgery if you have a fibroid. Open surgery isn't the only option, but they were quite adamant with me that this was my only option. So I had to go and look elsewhere because I didn't believe it. I didn't believe that was my only option. Just such a big surgery and such a long recovery time. I didn't want to believe it, so I had to go and find something else.
Absolutely. You took such an active role, and often some patients just accept that. From our Facebook Live session last week, 2 weeks ago, we realized that a lot of patients just trust their OBGYN because they've been going to them for such a long period of time that they don't seek a second opinion and they don't do their own research like you have. And that's so important.
It is. It's so important. If I hadn't done that research, I wouldn't have known what else was out there. I think you do have to do your research whenever you are diagnosed with something like this. It is really important to get a second opinion, but also, yes, definitely do your own research. Know what's happening in that field. What advancements have been made, what's going on now. You don't have to take that as your only option. I think it's a really good idea to do research and definitely get a second opinion.
Absolutely. Dr. D, have you seen a lot of patients who come to you looking for a second or third opinion?
Yes, absolutely. Because our practice specializes in minimally invasive surgery, yes, patients come to us, and often it's a second or third or fourth opinion because they have the other options presented to them weren't what they were looking for. Either it was open surgery, or maybe it was a robotic surgery, and they were looking for another type of minimally invasive surgery that perhaps was less invasive. So yes, absolutely, because open surgery is still, the most common surgery performed, major surgery performed by the OBGYNs, by the specialty. So, a lot of patients come to us as a second opinion. And sometimes patients are looking for a practice that specializes in their condition. So maybe they were offered laparoscopic surgery somewhere else, but maybe they feel like that provider only does a few surgeries a year and they want a specialist. They want someone who does these regularly, and maybe would be more prepared to handle complications, or if there's scar tissue. Some things, sometimes there's only so much information you can get from an ultrasound or from your preoperative evaluation. So you really don't know what's going on until you get in laparoscopically and see what's happening. So sometimes the surgery turns into something more difficult than what you predicted, and they're looking for a specialist who's more prepared to handle those difficulties.
Absolutely. So, Rupal, you decided that you wanted to seek a second opinion, but what made you decide to travel all the way from the UK to the US for minimally invasive surgery? So could you take us through that thought process and that journey?
Sure. So initially, when I was told what my procedure option was, I thought, okay, no, I need to see what else is out there. I need to know what else is going on in this field. So I started researching, and I started Googling literally laparoscopic myomectomy. And from there is when I saw all these options. Now I know that there's where the surgeons do it, and then you've got robotics, and and I had to weigh it out as well. I needed to know all the pros and cons of doing it in these ways. And what I needed to know is, am I a candidate for a laparoscopic surgery? Because it had been put in my head that I'm not. No, it's far too big. It's impossible. You can't do it that way. And then I started researching. Right, I need to know who can do it this way. And I came across CIGC, and I thoroughly read the website. And when I initially reached out to your team, and they had a look, and they said, okay, right, send us your scans, send us your documents. And as soon as they saw that, they said, well, you are a candidate for laparoscopic surgery. I don't know why you've been told that, an open myomectomy is your only option. Mm-hmm. And it was definitely like the back and forth, getting the opinion from the doctor, again, doing a lot of research, reviews, but once I saw the actual procedure, I had to read up on it. For us, we're not scientific, so we don't always understand, the very technical science terms or the equipment that you're using. But from what I had read on the website and the way that the procedure was being performed, that is what swayed me to come there, because I hadn't really seen that over here. There was an option to do it robotically over here, but I wasn't too keen on that either.
Now, if you, kind of like a side note, if you decided to do open surgery there, would it have, in terms of how I'm not too familiar with how the health system is set up there, would it have cost you more or less?
So I had looked into it. If I had done it, so we have the NHS here. So NHS means you get everything, you do it on the National Health Service. So essentially you don't pay for it. But there's a really long wait for that. So if you do it that way, my options were, I was still looking at my initial wait just for a laparoscopy the initial one was 8 months. So by the time, if I had done it that way, the waits are just way too long. It would have been over a year before I would have actually had the surgery. But if you do it privately, when I had worked it out, it was actually the same. It would have been roughly the same whether I had done it here or done it there.
Right. And I think, Dr. J, you can speak to this in terms of, for conditions like endo and fibroids, waiting could be really detrimental, right?
Yeah, absolutely. I mean, on many different levels, right? So if you have bleeding, for example, right, your anemia, which is a low blood count, can worsen. Or maybe you weren't anemic, but if you wait, 8, 10 months, 12 months, as the fibroids grow, your bleeding can become worse and you can become anemic. And then you either, your surgery becomes higher risk, because then you're worried about having to get a blood transfusion because of additional blood loss during surgery. If you're having pain and you're having to be, let's say, on pain medications, and a lot of patients are being prescribed narcotics for pain medications, certainly, being on these strong medications for 6 months or 8 months, it's unreasonable, because then you're at very high risk of dependency and potentially never being able to return from that. Fertility, is a big aspect. A lot of these conditions impact fertility in a negative way. So with endometriosis, sometimes it's irreversible damage. And so if you wait 8 or 10 months, it could be, something that puts you over the edge, and maybe you will never conceive regardless of, the treatments after that. So waiting that long is detrimental, absolutely. And just then quality of life, right? If somebody who's in pain, who's miserable, who's bleeding, last thing they want to hear is that they have to wait another 6 months or a year before they can feel better. That's a very long time.
Right. And so, Dr. Janelians, do you see a lot of patients that travel to CIGC from outside the area, outside the country?
Yeah, absolutely. Outside the country, outside the tri-state area, absolutely. We have patients from the West Coast, and then of course abroad, from the Caribbeans, Australia, of course the Western Europe, Asia. So yes, absolutely different parts. I think that just shows that the kind of the obstacles that our patients have in the U.S., they go beyond the U.S. and it's the same thing. That just the specialty, the OBGYN specialty, is not very well trained surgically, when it comes to these minimally invasive procedures, because you just need extra training. And laparoscopy takes longer to learn. There is a steeper learning curve. So but because the way the training is set up here and elsewhere, patients then, again, have the same obstacles of finding that specialist, finding that person that does these repeatedly, and, can handle more complicated conditions.
Now,
so I think when we educate patients, when we reach out to patients, we definitely have to keep in mind that this is a global issue. This is not just an issue in the U.S.
Absolutely. So you were talking about training and how being a surgical specialist they undergo a different type of training than OBGYN. So given that you are a surgical specialist, could you speak to and kind of explain how endometriosis and fibroid removal is achieved here at CIGC?
Yes, absolutely. So, it's small incisions. The surgeries are outpatient. So that give the patient completely different experience. To have to stay in the hospital, 2-3 days or 5 days, it's definitely much different than being home in your own bed the same night. And that's because the incisions are very small. So with small incisions, you typically require less pain medications. So you don't need IV pain medications, right? You're able to move around. You're able to eat and drink right away. You don't need IV fluids. So, so all of these things allow you to just go home and be in the comfort of your own home, and also recover much quicker. But like I said, to get those surgeries done with small incisions, it just requires more training on the doctor side, and doing these surgeries all the time. So it's not just enough to do the training. So let's say you did it an extra year or two of minimally invasive surgery or fellowship, but then after that, you have to continue to do these surgeries repeatedly. And sometimes, unfortunately, there are just not as many practices that do high volume of cases. So even we've seen that the OBGYNs that go on to do a fellowship and do 2 years of training and come out really, very interested in laparoscopy, and maybe come out having learned good skills, but then they join a practice that does, again, mostly obstetrics, and then they kind of lose the skills that they learned, so they're not able to maintain them. So it's definitely, there's many limitations, but as a patient, all you can do is just find that specialist and find somebody you can trust as well.
Sure. So Rupal, you came, you had surgery with our CIGC specialist. How did you feel after surgery?
After surgery, obviously you're obviously going to be in a little bit of pain. It is, you still have had surgery, but I was surprised at sort of how quickly I did bounce back. Compared to 5 nights in hospital over here, I think on my 5th or 6th day post-surgery over there, I went sightseeing. You walk slow, you move slow and everything. but I didn't take any of the really strong pain meds either. I think I had what was given to me when I woke up. And then I think after that I was just taking the ibuprofens. So in terms of pain management, that wasn't so bad. You know, once initially, yeah, you wake up, you are in pain and stuff, but then that went away quite quickly. And I know from the next day, well, even just from that same day, you are walking. You know, you're not bed bound. You can walk, you can move around. And I flew home, I think, on the sixth or seventh day post surgery. I flew home, and then once I was home, I mean, you know, you've got to be careful. But I was walking, I was moving around. I didn't feel like I just have to stay in bed and I have to recover. I didn't feel like that at all. You know, from the next day post surgery, I was walking around the hotel room. I was walking the corridors. You know, you're very slow, but you're moving. You know, that's the main thing. You're on your feet. And you can do things.
That's great. How do you feel now?
Yeah, now, so it's been I think it's been nearly 2 years since I came there. My last MRI, which was, well, it was last year, but it showed that the fibroid hasn't grown back, touch wood. But other than that, yeah, I mean, I feel okay. I think during surgery, I know the doctor, she did remove some endometriomas and stuff. So I think those were still coming back. But at the moment, I stay on the pill, and that sort of manages everything for me. Because as you know, endometriosis, it's not cured. It's something that has to be managed. You know, it's something you have to manage. So taking the pill, that's my way of managing it.
Good. I'm so happy you're doing better now.
Thank you.
And I think this next question is for you both. We'll start with you, Rupal. What word of advice do you have women that may be experiencing the conditions you're experiencing, maybe travel patients, and maybe going through the journey that you're going through? If you can give them advice, what would it be?
Definitely do lots of research, and if you know, sometimes you really do need to push to get your diagnosis as well, and don't take it's normal for an answer. It's very common, but it's not normal. And I really can't stress that enough to all the women out there. You know, I don't want anyone to be sort of led to believe that, oh, it's normal, because it's not. This pain is not normal. The condition is not normal. It's just, yes, it's very common. And there's a difference. So I would definitely say do lots of research as well. Push to get your diagnosis, and you got to find the things that work for you as well. You know, you can't just sit on the advice that you've been given. Get a second opinion as well. Get a specialist to look at what's going on, and yeah, just don't give up. There are some really, really terrible days that, you know, especially when it comes to the pelvic pain. There's, you know, and I know that's very difficult to manage as well, but you know, I think just doing your research and speaking to the right people and getting the right help as well from the right people, that's the steps that they need to take.
Absolutely. That's wonderful advice. And Dr. B, what advice can you give us?
Yeah, I mean, I definitely agree. Don't, you know, just because somebody tells you it's normal, if you feel in pain, then pain is not normal. If you feel like your quality of life is not the way it should be, then, you know, trust yourself. Trust your body to know that what you're experiencing is not normal. So don't trust every doctor that you talk to. And if you need to get, you know, 5 or 10 opinions, just do it. And then another thing is, you know, don't delay, because I think the next step, you know, once the person sort of knows that they need treatment, right? Let's say the doctor, everybody's agreed, yes, there's something going on, whether it's fibroids or endometriosis or maybe both. You know, don't delay, because I think sometimes the fear of surgery keeps a lot of people from moving forward, right. and their condition gets worse. And it actually makes things worse, because fibroids aren't going away, right? And endometriosis is not going away on its own. And it's really, a lot of times these things need to be treated surgically to improve things, and keep them from getting worse.
Absolutely. I really love what you both said about just because something is common, it's not normal. And I think we really need to reiterate that point especially in terms of pain, because we're brought up, and I think maybe a cultural thing too. It's pain is passed on, and you see it as normal, but as Dr. D said, it's not. So absolutely, yes, trust yourself, do your research, and just take action in your own health and your own GYN health. So I am looking at some questions here for you both. So Ken is saying, what was your process, Rupal, what was your process like as a travel patient? I believe you've answered that, but if you wanted to add anything else?
Yeah, just I flew in 2 days before the surgery, and I flew out 6 days later. But I know if you have a shorter distance to travel, I mean, I know a lot of the women I spoke to actually flew home about 3-4 days after their surgery. It's only because I had a much longer flight that I waited the 6 days. But you know, when I came back, nobody would have thought that I just had surgery, or, I mean, I started working again. I was just being very careful. Yeah, but it was quite an easy process.
And I believe you stayed at a hotel near the center?
Yeah, I stayed at a hotel nearby, so that I could. It was only, I think, maybe 5-10 minutes away from there. So it was, yeah, and it was very, very easy to get around. It was comfortable. I mean, once the surgery was over and I was in the recovery process, it was just about, you know, keeping comfortable, and I was on my feet quite quickly.
That's great. Now, we have a question here from Dolly Sherman. Why aren't all GYNs informed of this option? None of the GYNs I've seen in Arizona have any idea what I'm talking about when I tell them what this procedure is, what it's about, and how it's done. They always assume it's robotic, and I'm like, no. So I think Dr.
Yeah, I mean, definitely, you know, a lot of physicians, a lot of OBGYNs have never heard of this procedure, have never seen it. So they don't, when the patient says, oh, it's minimally invasive, you're right, they either assume it's laparoscopic and robotic. And that's when they start telling the patient, well, you're really not a candidate because you have, you know, 20 fibroids, or you have some fibroids that are deeper in the uterine muscle. And it's true that if you were to just do it robotically or just straight traditional laparoscopically, you wouldn't be able to get to all these fibroids, and it's really not the safest way of doing it. But with the LAAM approach, you know, it's a kind of a hybrid procedure. It's a combination of small open incision and laparoscopic. And with that approach, you really kind of eliminate the limitations of just doing it the traditional laparoscopic or robotic way. So that's the beauty of this procedure. But yes, that's very common. I hear patients that they say, well, I explained it to my doctor. They said they've never heard of it. And it makes it harder for the patient to make that decision, you know, to travel, or even, you know, local patients here to say, okay, I'm going to trust CIGC, even though my own doctor, who I've known for many years, said this procedure doesn't sound like a real thing.
Right.
And you know, that's definitely very difficult, but I think it's still worth, right, getting a consultation, and as Rupal said, really understanding the procedure yourself, right? Looking at the website and asking the right questions to really understand, how is this performed? Does it really make sense? And you know, if it's something that doesn't make sense to you, then you don't do it, right? You go with, again, you have to go with the person you trust. And with the procedure that you think makes sense. Absolutely.
Yeah. We have a comment here. I just wanted to read it by Sabrina Jones, and I think it's an important comment. She's saying, my GYN was the same way, but they aren't set up to try to find you additional options that are less invasive. Their goal is to just go over what they offer. Sad, but true. It's important to do our own research, and absolutely. Yeah. It's just reiterating that point. So I think I don't see any more questions here. Thank you both so much for joining. Rupal, thanks again for joining us. And as Dr.
No problem. Thanks for having me.
Earlier.
All right. Thank you so much. Thank you, Rupal. Bye-bye. Bye.